Welcome, everyone. My name is Talita from Stoke Surf Fitness, and I'm going to have a chat with Maud from Nanu Motion around how to navigate the mountain of information on social media and the importance of if you have back pain, how you should have a one-on-one assessment with a qualified professional. A bit about my background. So, I'm a qualified surf coach, physiotherapist, and strength conditioning coach, and I'm specializing in doing like strength and conditioning basically for women who surf. And I'd like to introduce Maud, if you could tell us a bit about yourself.
Hi, thanks for having me. Yeah, I'm a physical therapist from now 11 years, and I've worked mostly with people with back pain because I've lived back pain myself. So I developed that expertise pretty quick in my career, and then I got passionate about surfing and moved to the ocean and started working a bit more with surfers. It's been more than 5 years now, and I work in clinic. I have a hybrid practice. I work in clinic with surfers and also online. And yeah, I've been surfing myself for, well, at the beginning on and off, but more consistently for 6 years. And I surf either longboard, shortboard, and yeah, I got hooked now. I cannot not live next to the ocean and surf as much as I can.
Nice. Cool. Well, welcome and let's like dive into it. Faux pas on the internet around unqualified kind of trainers giving information around areas that probably just need to be covered by physical therapists or physiotherapists and kind of the why that is like the dangers, and I thought that would be quite interesting. Because I think a lot of
Mhm.
people don't obviously know around that kind of area, and all the physiotherapists are like slamming their heads into walls, but I don't think there's
Mhm.
actually a lot of people speaking about it, like actual physios then
Yeah,
going on and saying like, well, actually,
yeah. That's good. I mean, I wouldn't like target anyone or like
no, 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 no.
um or like I don't want to like so what I'm thinking is like it's just how the trainers sometimes they target
Yeah,
people with pain
yes,
as a solution for their pains. And
yeah,
like of course for some people that will be a solution because they're just out of shape. And it
yes,
might work, which is awesome, honestly, because everyone needs to be more active, everyone needs to be like more strong.
for
But
sure.
for some other people with like chronic pain or people that are already have a baseline physical, shape and they're still in pain, then
Yeah,
getting stronger or getting on a generic program, it's probably not the solution.
yeah,
So yeah, just wanted to nuance because it's not bad
no,
in
for sure.
itself. It's just that I don't know if it's because I'm a physio that like I get all the trainers like posts that talk about pain. So I'm just like, wow, all the trainers talking about pain. Like just,
Yeah.
I talk about training and talk about getting stronger and performance. And yeah,
Yeah, yeah, no,
yeah,
totally agree. Like I think it's really good you said that because I'm of the same like opinion. Like I don't want to like, nail anyone to the cross or call anyone out. Like we kind of again talked about before. It's not what I'm interested in. It's just providing more information that's actually accurate onto a platform that's full of inaccurate information and lack of nuance. I think like that's the theme of it all, isn't it? And that's why we went to study. That's why we did our degrees, is to be able to nuance between, well, that's just a regular pain, or like this is a problem. Like you need to go see someone. And I think it's quite interesting actually, because I think a lot of like strength and conditioning coaches are saying the same things in reverse. Like, why are physios talking about strength and conditioning? Like, what do they know? Um,
yes,
but I think you can't really flip it the other way around, because I think our
yeah.
scope, we have that scope if we do further training to be completely competent in that area, but I'm not so
Mhm.
sure you can just like turn it around. But yeah,
There's
I'm on the same
definitely
page.
an overlap, that's for sure.
For sure.
So
Yeah.
so people with pain, they will be like rehab. And then, like, at some point, you need to integrate some strength training for the person to not get, fall back into that vicious circle
Yeah, yeah,
of
for
getting
sure.
injured again. So, like, how I see it is like rehab and then like prehab, which would be like prevention, which is still in our scope because we did assess the client for the problem. And then we
Yeah,
notice, like, okay, the problem is actually caused by this, and this. And then as the symptoms go away, we know the underlying cause is probably still there. So we still need to work on it a little longer, even if there's no symptoms, for
yeah,
them to be, discharged and go back into their sport, into the ocean, and go surf without any worries. And
yeah,
that's
yeah,
where the coach for me, like, okay, like you want to, now you're out of pain, you want to perform. Okay, let's go see a trainer. I won't, I won't step in. I know like it's out of my scope. I know there's people more qualified than me. I know some physio do, it always depends on the person,
yeah,
definitely. As you said, like there's some physios that don't know anything about strength training. I
yeah.
I do like it personally. I think it's like you can't differentiate strength and rehab. Like as I said, like
It's on the, yeah,
re
on the same continuum for sure.
exactly, like it's just a question of dosage. So you're gonna do like low load exercises to target specific structures, and then like that will be called rehab, but it's still
Yeah.
doing strength.
Yeah,
Yeah,
yeah, for sure. It's just that lower level, isn't it? And you're
yeah,
targeting different things than someone who's performance coaching.
yeah.
But can you talk a little bit more about, how you said like the assessment part, like can you talk about the importance of like assessing a person individually, like as a physiotherapist, and like what are you ruling out, what are you looking for, and why is that important for people who are in pain to not just jump straight into like a generic training program?
Yeah, very good question. Because that's the part that is unknown. People don't know about, well, physio. Most of people don't know what we can do for them, and they don't know like the process, like why are we good doing it? Why is it going to be better than anything found on YouTube? So yeah, the assessment is basically when you see the person for the first time and you do like that questionnaire or that investigation on like screening for everything that can cause the pain. So it can go from just lifestyle habits. How many times do you sit? How long do you stand? How many times do you bend over during your day? And for example, for me, well, I treat mostly back pain. So that's
Yeah.
those questions are very relevant to back pain. But like if it's an elbow injury, obviously will be other questions. But just knowing what the person do in their life as like movement wise, but also like other things like does a person rest well, eat well, I mean sufficiently to like promote the healing. And then we go a little bit deeper into mobility. So is the person able to squat? Is the person able to move full range of motion into all the lower body, upper body joints? And then you find at some point restrictions. And then the hard thing here is not to find the restrictions, but is find are they actually related to the problem or not? Because you can start moving all the joints and like do exercises for everything, but it's gonna just take so much time and be so overwhelming. So in a real life, busy people, professionals, you wanna you don't want to spend more than like 20 minutes doing exercises per day, or at least like maybe two sessions of 20 minutes at the most, realistically. So yeah, that's where the assessment becomes so important, because what the person's going to implement in his life as a routine, a treatment plan, will be very targeted. So he's not wasting his time doing a bunch of stuff that's not going to help actually heal the injury.
Yeah, for sure. And likewise, right, if we take quite a classic example of, you can see you type into the search bar on Instagram, back pain surfing, and you'll get a load of videos pop up about like, oh, try this exercise if you are in back pain. It is likely because of X, Y, or Z, and they give some suggestions. But as physiotherapists, we see that and we think, oh no, like, please do not try these movements because, it could be something very aggravating for that person, depending on what stage of their back pain they're in, or what exactly might be wrong for that individual. Do you want to speak a little bit more about kind of the importance of, those individuals who are not suitable for that, and kind of the things you might be looking to rule out quite specifically, and yeah, a bit more about that side of things.
Yeah, well, definitely, if the person, for example, with back pain, for example, if the person has, well, numbness and has like weaknesses and other symptoms like that, and it's like it's getting worse with time, like we don't want to, waste time trying a bunch of stuff on YouTube and just making the person worse. So there's always, you want to like rule out the red flags, which would be uh, like a higher nerve compressions or stuff like that. We don't want to mess around with that. But like for most people, it's not. But still, it's just like frustrating because there's like that hope. Oh, I found that new exercise, and then I'm just gonna try it. And people have no idea, is it gonna work? Like, is it supposed to work after like a week doing it or like 3 months? And then like they're just in that back and forth of like jumping from one exercise to another, jumping also from therapist to therapist, because
Mm,
there's a bunch of things you can do. Well, to when you're in pain, you can go see a massage therapist, you can go see an acupuncturist, and all those things will help for sure. They will help to relieve. In some cases, they can even solve, but in other cases, it doesn't address the root cause, the underlying issue, and that's when it becomes problematic because people stay in pain for years and they don't know what to do, and they just think they're gonna stay like that forever, or they go see the doctor and then like they go for many scans, and but the scans, they don't, you don't see how you move in a scan. So yes, you can see if there's some damage in the spine. I do like that because sometimes people with no pain actually show damage on their MRI, stuff like that. So yes, it can be useful to go there, but it's definitely not the first thing to do. And people end up in that direction most of the time first. And then after they see, well, medication, massage, or other things. I don't want to talk against massage, it's very helpful. But those things alone, like medication is also good in some cases. Like you're in pain, like take it, like get better, like yeah, follow the advice of your doctors. But if the pain remains, at some point there's something else to investigate. There's something else to look for to really solve the problem
yeah.
for long term. Yeah, that's
And
the
that's, of
sad thing
course,
about it. Yeah,
for sure. And that's without even getting into things like chronic pain and all the
yeah.
pain science education. And, again, when we kind of see those posts on Instagram where there are non-medical background profession, like exercise, maybe professionals kind of making these claims, and you think, yeah, but that person could end up in a pretty bad way, and, end up on that spiral pathway that you kind of just described. And it's just a shame. I think it's a shame because those people are sometimes, genuinely looking for a way to get better. They're trying everything, and they really want to get back to surfing. And, and like you said, that's kind of a lot of the story of the people that you see eventually.
Yeah.
They've tried everything. They've tried all those generic programs, often found it made it worse, didn't understand why. And, you know, it's just a shame that it takes such a kind of rigmarole of things for someone to end up in front of, a specialist like yourself, for example, who's qualified and, has the knowledge and the power to help that person, because it's not like you're hiding. You're right there. Um,
Yeah.
but yeah, what do you think can kind of increase people's awareness of maybe false information on Instagram, or kind of finding the right like place for them? Have you got any
Hmm.
thoughts on that?
Yeah. Well, Instagram is a tricky one because people, if people click on it, if it's entertaining, people will click, there'll be likes, there'll be comments, and it'll be shown. So what
True.
is shown is not necessarily the things that are the most relevant. but the things that the algorithm, I'm not a specialist of it, but my understanding is that like they will be shown what is Instagram will think they will like to see or spend more time seeing.
Yeah, yeah,
Uh,
the algorithm.
so yeah, like algorithm, exactly. So that's maybe why, I mean, we are on social media. Like there's little qualified rehab professionals on Instagram because we're busy. We're busy in the clinic. We're busy, treating people all day. And yeah, it's just that people end up um, well, we are all on our phone now. It's the way we're feed information. So people will see more of that, like all those exercises, super promising for all sorts of pain on Instagram instead of like looking for other solutions. And also, there's many people that come to me that say, I've tried physio and it didn't work. So, after you tried once and you're just like, it didn't work, well, you push that away and you're just like, I'm going to go towards something else. And that's very sad because, I mean, of course, like it's like everything. Like one therapist can be super good and one other therapist, not
Yeah,
being as good.
for sure.
And there's like, there's some also ideas about physical therapy from the past, which is more like you go there, you get plugged on like an IFC machine, the electrodes, a TENS machine, and you're laying down most of the treatment and you do low load exercises forever and you don't get better, which is true. Like if you're doing that in physical therapy, you won't get better. So there's that thing where you need to find also the right therapist that know your sport. I think that's very important.
Yes, I couldn't agree
And
more.
yeah, because especially for surfing is like super specific sport, and like most of people you ask, oh, what is surfing? Well, you're always on your board. You should get like you should be super strong of your legs. We're like, okay, yes, but most of the time we're not on the board. We're like on our stomach and we're not on our feet. We're just like using our arms. So we need like upper body strength more than leg strength. Just like a very simple example, but
No,
yeah, just
definitely.
just to say that if you go with the therapist that is not necessarily the best for you, you might not get the results as much, and then like people just kind of say, "Oh, that didn't work for me," but no, it can still work. You just need
Yeah.
to find the right treatment for you.
Like it's not easy. Like I completely agree with all you said, but even you're we should probably talk a bit about each other's backgrounds, like introduce ourselves. I realize we just kind of skipped past that part, but as qualified professionals in the industry, sometimes even looking through Instagram, like it's so overwhelming and like it's very convincing. And then you think, I don't, what's the evidence for that? And we obviously are tied to ethics and all these kind of things where we're supposed to be using research. And I just don't think, again, there's much awareness. And I don't blame them. It's not like a you should know thing. It's just, I just don't think people outside of physio or medical professionals are aware that we are so data driven by research and, that we have ethics and morals that we need to adhere to versus, anyone who wants to join Instagram can just say whatever they want and they will not be held accountable for it. And whereas if we do something like that and we got investigated, we would lose our profession. So there's like this extra almost trust, I would say, that comes with, you know, being with a medical professional in whether they're a chiropractor or a physiotherapist, a doctor. Um, but then, like you've highlighted, even within those spheres, there's just such variance in people's skill sets. And like you said, having a physiotherapist who surfs, who understands the sport is like super important versus, maybe someone who is into sports like rugby, soccer, they might be able to think about surfing, but like you said, maybe they think about the standing up part and not like the 90% in between where you're just paddling all the time. So I think it's super hard, like for people to understand where to go, who to see. Okay, if that didn't work, should I just kind of ditch that route and go try a different route? Or like, it's not easy, I don't think.
Not easy at all. Yeah, as I just said, like our background. I mean, we're studied what? almost 10 years for becoming physical therapist. And well, after graduated, you have to do like continuous education and all of that. And yeah, that's just the clinical exposure. That's what makes us well suited for treating, and also like as we said, like ruling out also the more um like the red flags, the more serious conditions.
Yeah,
Because
definitely.
most of people, they come and see us first. So they're not like seeing necessarily their doctor before they see us. So if there's something like strange, it's not like evolving the way it should. Like you have to be like, okay, like there's something that's not going well. You can refer. And yeah,
Yes.
sometimes when you go through, I don't know, maybe a generic program, you won't have someone to be on your corner and like, okay, like you're doing good, that or like just adjust if something doesn't work, because it's very unmotivating also when you are by like on your own. Like even myself, when I get into an injury, even with all the knowledge I have, even like all the experience I have, I'm not able to treat myself. Like I have to see someone's telling me, okay, like just the way you feel yourself, it's not objective. Like you
No,
want
it's
to
not.
you want someone to see, okay, like if you're not stable from your hips, you're like twisting every time you move your arm, you're twisting your pelvis. Oh, okay, I didn't know that. And then like, that little movement, repetitive motion can cause some overload in some part of your lower back. Oh, okay. Then that must be why every time I surf, I'm super stiff the next day. And then, okay, let's start working on that. And then once you understand to like activate the right muscles and you just build strength on top of that, you're like, oh, I feel the difference now. It's just like that awareness. It's just
Yeah.
when you sometimes you just do like an exercise that's supposed to work on stability, and you end up just doing the motion like you've seen the video, but like you don't know what the intention behind the exercise. I find it
Yeah.
so helpful to have someone like to say, okay, you're doing it, but you're not actually engaging what you need to engage to do the exercise in a stable way. And then once you change that, you're like, oh, now I'm not losing my time. Like now I can actually get better. So that's small details that the same exercise you can do with intention and without intention, and you'll get two different results. So
Yeah, for
there's so many
sure.
people coming to me and say, oh, I've done that exercise many times, like didn't do anything for me. Okay, let's have a look. And then, oh, did you think about that? Did you think about pushing harder into that hand? Did you think about, keeping your transverse muscle? Like you don't even know most of the time what I'm talking about. The breathe, like they would hold their breath. They would like many things, many little details that would make the exercise not uh, as efficient. So yeah,
Yeah,
that's one
yeah.
of the
Like
things.
breaking it down and like layering it back up again. And
Yeah,
yeah, that is super important. And like you said, kind of having those objective measures, whether that's the quality of the movement, it's not just, what you're doing, it's how you do it. Um, and like you mentioned at the very start of that last point was, if things are not going well and things are not responding in the way that we would expect, we monitor constantly for those kind of red flag symptoms. And for people who don't know what red flags are, I guess we should also just outline what that kind of means, um, more so, and maybe talk about the spinal nerves and what they control and what that could mean and why that is so important when it comes specifically to back pain, and also because surfers are an extension so much, there's likely higher risk for things like cord compression and just like slipped vertebrae and things like that. It's rare, obviously, but I think
hmm
in that population, it's super relevant.
yeah,
Again, like with the neural symptoms you mentioned, just things that maybe people could, we could spread some awareness about caudate equina syndrome, like you already mentioned some neural symptoms, just so that they know like this is not normal and you should definitely go and see a qualified person about this before you join some other program and hope that it'll fix everything. So um I don't know if you want to lead on
yeah.
those
No,
because I
that's
think you're
that's
more on the
super
physio side
important.
at the moment.
Yeah. Um, of course, like if there's so the in the assessment, you able to like as physios we're able to like know if that there's a risk for like a serious, more like a severe injury. And like as we do a treatment plan, it will be very obvious if there's something like that gets worse, aggravating, or then there's any sign that the person should be referred. And most likely will be like aggravating nerve symptoms into the legs, like numbness, loss of sensitivity on the skin, loss of strength. For example, not being able to lift the big toe. That's one of them, a pretty frequent one. And those symptoms can be temporary, or they can, or sometimes when the compression of the nerve is more severe, they can be permanent. And that's the one we don't want. Okay. So just the so that how the spine I have a spine I can
Bring your
show you.
spine out, Maud. I love it.
So so there's many things here. You can see all the vertebrae stacking up on together. So here there's the disc, and here you have two vertebrae that are moving on top of each other, and then you have the nerve coming out, and there's a hole where the nerve comes out. And when we are prone on the surfboard, I don't know if you will see, my spine is not very flexible here,
Now it's
but the
moving.
hole is getting smaller. Okay. So if we are in that position for a long period of time and we have arthritis, so there will be a like little degeneration closer to that hole and close to the joint. And sometimes it can be little outgrowth bone that go into that hole, and it's already a little smaller. So if we are in that position and you have that, maybe the nerve can be aggravated, can be irritated, or sometimes it's just the fact we don't even have arthritis or anything that obstruct that hole. And just in like because you're not controlling well, I was thinking talking about the little rotation that can happen. It will compress one joint more than the other, and then there's inflammation, and just like the chemicals that are created there by inflammation can just affect the nerve, and then you feel in your leg. In that case, it's more temporarily because it's only caused
Yeah.
by chemical cause instead of a mechanical cause, or yeah, biomechanical cause. So
Yeah.
in either cases, we have to first unload what is triggering the pain, and that's what the assessment is all about. So in that case, that person that feels pain or feeling more shooting in his leg with surfing, with that prone extension, standing for a long time, walking, reaching up for stuff, all those things, we know, okay, so that creates extension, so that fits with mechanical a mechanism of injury of that type, for example. So it's kind of a detective work to find the cause. So there is surfers that will get that type of pain. And as you said, there is more serious condition where it could be a little fracture and the vertebrae like slipped forward, and that can even compress the the spinal cord. We don't want that. That would be
No.
like shooting electric shock in both legs, and yeah, can be more severe. Also, like all the symptoms in the pelvic area, we like that's a little bit more severe. Any difficulty starting urinating, or any numbness or loss of sensation in the pelvis area, we have to be very aware of that and refer. But as you said, it's not that frequent, but we have to know it exists, because when you get
Exactly.
someone with that, it's like, okay, this is like can change his life if it's not treated. We have to go and,
Yeah.
get that
It's a
medical
medical
help.
emergency.
Exactly,
Yeah.
medical emergency.
Yeah, that was
So,
great. I love the spinal demonstration as well. It's great. Um,
yeah,
and then if I were to say to you, like, typical kind of sciatic type back pain, again, exploring the world of Instagram and sees, let's say Jefferson curls and thinks, oh yeah, I feel super stiff. Let me try Jefferson curls with a 5 kilo dumbbell. And, they try it and lo and behold, their sciatica is way worse. Do you want to
hmm,
just talk through why that is very predictable from a physio brain and,
yeah,
getting an assessment and how that can all be avoided? I'm just thinking some practical examples might be quite good.
yeah. I love that example of the Jefferson curl because I see it all the time because you know they know it's controversial. So controversial things like they talk
Yeah.
more and like
Yeah, yeah. Gets
there's
popular.
more, yeah. So it is a controversial movement because the example I showed you with the surfer in extension, for the everyday surfer, it's often not a problem. It's not that causes the back pain. Because the everyday surfer, what it does is at the computer all day, sitting with a rounded back, okay? And it drives to work, sitting, mostly head forward, rounded back, shoulders forward. So the extension is probably good. Okay. When you go
Yeah.
surfing, it's probably, okay, yeah, another position for my back. Perfect. So
Yeah.
I would say it's different at a professional level where people surf like 5, 6 hours a day. Okay. And then you can, lean a little bit more towards that. But the everyday surfer, most likely disc are a bit more compressed, muscle always overstretched, stuff like that. So for those people, I would say like the rounding position is probably more aggravating. So I always use that example where if you hold your finger like that for an hour, how would it feel after an hour? Well, sore because the finger is always in the same spot. So either you have that arch back position for an hour or that round back position for an hour, you'll end up sore. Okay. So the thing about the back is that it's not as obvious as this. You can be sitting and being end range flexion of your back. So right now I don't have much space. Right now it's like I'm totally flexed in my
Yeah.
back. I'm in end range, okay? But I don't feel it as much because it's not as obvious. And then over time you get sore. So it's mainly the control, like
Yeah.
noticing, okay, I don't see my also you don't see your back all the time. So you don't know
Of
how
course.
how is it? So being aware of that, saying, okay, how can I stay a bit more in the neutral zone, not at the extremes all the time? So with the Jefferson curl, for someone that is always in that extreme of flexing all the time, does he need to flex more or with weight? Probably not. Okay, knowing that the disc first injury mechanism is bending with weight, well, sometimes twisting as well, but like bending, repetitive bending or sustained um, flexing. So yeah, in those cases, I'm just like, no, no, just don't do that, or not yet. I mean, you can probably do
Yeah.
that at some point when your back is pain free, when you understand what's your trigger, and then you build up tolerance progressively, and then you can probably go back to that. Is if that's
Yeah.
what you want. If that will also like you have to always see if that's gonna serve you that exercise for what you want to do. Like for surfing, do we need to load that end range flexion? Maybe when you like compress and do like at more advanced turns, I would say, but most likely for most surfers, we probably don't need to get that far or not with a lot of weight anyways. Or there's
Yeah.
probably other exercises we can use. We always have to see the risk
Like
versus
lower
benefit.
risk. Yeah. Yeah. For
Yeah,
sure.
but all exercise are good. They're not bad in themselves. We just have to
It's
take
that
them into
nuance.
into context, exactly, and for
Yeah.
who and for what goal. So
Yeah.
that's what Instagram doesn't show,
Yeah. Oh, I love that answer.
unfortunately. Yeah,
Yeah, for sure.
yeah.
Just, I wish nuance could become the new trend.
Thing is that the nuance, you people will say, "Oh, but what do I do?" And then they will
Yeah.
be like, "Ah, that's not a good pose. I won't like it. I don't know what to do." Well, it's not
Yeah.
that simple. Yeah.
That's true. It's probably not very viral type material, but that is the reality of for most
Mhm.
people, isn't it? It's not a yes or a no. It
Yeah.
depends on who it is and not just who, but when. Like, are they in an acute stage, subacute, chronic? Are they, you know, really recovered and they're not in a current acute phase, but it's that nuance that just, yeah, most of the time is missed and you don't know what you don't know. So it's hard
Hmm.
then to think that, oh, there's something else behind this. Oh, this person
Yeah.
seems legit. They have 2,000 followers or 200,000 followers. They surf pretty good. They look in good shape. Yeah, they must know what they're talking about. Like, I get the credibility aspect, but then,
Hmm.
yeah, it's just not how it goes.
Hmm. And something I notice is also people like I've lived it and therefore, you know, so
Yes, their
it's
personal experience
yeah, so
turned
I mean
practitioner.
it can be good. Like I've lived back pain and I learned so much as a
Mm,
human and as a
yeah.
therapist having back pain. And I know what was helping me in my case. But it might not be the same for another person. Like every day there's a client coming to me and saying, "Oh, but do you think that will work for me? It worked for my aunt or it worked for my sister." Like,
Yeah.
okay, yeah, but she had that, like, but like our situation was like the injury. She has the same injury that you have. You're right, but it's not caused by the same thing. It's not so.
Yes.
It might not be help. What helped her might not help you. So that's the
Yeah.
thing that is harder to understand because it's like, oh, it worked for her. I want to do the same. Yeah, yeah.
Yeah. I think especially when it comes to back pain because it is so like multifactorial with the psychosocial, reasons behind it. Like you said, there's beliefs, there's fears, there's prior experience, and like you've just said, it helped you, but you are a trained professional and you're aware of your biases. You understand that you cannot just say, yeah, Jefferson curls and I don't know, insert whatever trendy exercise that they tried and happened to work for them. Like you can't just copy and paste that for everybody. It's just not how it works. If it was that simple, like there wouldn't be physios. Like we wouldn't exist because everyone would be better. So
Everyone would
if
use
it, if
ChatGPT.
yeah, exactly.
Yeah.
So yeah, I just hope
Yeah.
people can get some value from hearing this kind of a discussion around, from our point of view, like what are the dangers, what are the pitfalls, and you know, why is it so, yeah, not a good idea, probably. It's the best way of just putting it. If you're in pain, go get checked out, just even to clear your red flags, and then you know that it's, nothing serious. And also other like things mask as back pain, as like cancers and like you've already mentioned, fractures and the neural problems. And
Mhm.
I don't think the average trainer is screening for those things. So it's just there's a reason why when you're in pain, you are supposed to see someone who's a licensed medical professional. I'm not saying that, they can't help you and that there's not great trainers who have zero qualifications out there. There's definitely a lot of those too, and they're probably not even on Instagram.
Mhm.
But that's the danger, isn't it? It's just knowing that you need those avenues to get things checked and just do your physio and then you can go if you want, do some generic program, but I will always, 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 promote one-on-one, get a personalized program because it's for you, it's for your deficits. It takes into consideration your strengths and you're just gonna skyrocket your progress, compared to doing something quite general that, yeah, sure, there's general things we all need to work on as surfers, but you might already have some of those boxes ticked, and maybe it's something very nuanced. And yeah, like often it's very tied to a previous injury that hasn't fully maybe been rehabbed far enough into the continuum. Like that's another typical kind of classic scenario, right? Where they get a bit better and they sack off physio, bye bye, I'm pain free, but they don't stick to it just that bit longer and then cross over into the performance strength and conditioning. And then
Mhm.
they come back in a month
Yes.
because, oh, lo and behold, it's sore
Yeah.
again. And again, that's not to say, that's silly, you shouldn't have done that, but there's a reason why we do say like you need a certain time frame to work on things and just making sure rehab is complete. And something like lower back pain is very complex and can be affected by stress and sleep. And even if you do all those things, you can still have pain. And that is normal as
Mhm.
long as you've been explained to you that that is what you have and that you're not just guessing from the
Yes.
internet.
definitely the personalized like treatment plan, rehab plan is like what will really make the change because yeah, if you're just going in all directions and as you said, with any exercise program, there might be some of them that will help, but you will be and or most of them maybe you already strong in those movements and they're not why you're getting the pain. So yeah, it can be very frustrating when you're stretching every day. So many people come to me, I'm already stretching every day. I'm doing yoga. I'm going for walks. Like I'm doing everything okay. Like but I'm not getting better. Like, okay, well, there's more. There's more you can do, but people just don't know. So what you don't know, as you said, you cannot
Yeah.
go after. And and yeah, like sometimes you end up spending more time and money and trying many different things than like going one on one from the very beginning and getting that assessment, getting that understanding is like the main thing because I think the learning you have when you go with a therapist one on one and I, that therapist actually take the time to explain. That's another thing. Like most PTs in the context of work sometimes is just impossible. You go in a clinic, you're in and out in like 20 minutes or you actually with the physio like maybe 10 minutes during the entire appointment, which is 40 minutes. You don't have time to discuss and understand. So your therapist should explain why you have pain and making sure you're understanding why. Because if you don't understand, you'll be like, oh, I have like all those exercises to do, but like I don't even know why I'm doing them. And I don't know like what they're gonna do for me. And so the motivation will be super low. So as soon as you understand what's the problem and how the exercises you're doing and how I don't know, maybe it's a posture change, maybe it's adding something in your routine, like how that's gonna help you, then you're 100% most likely to actually do it and stick to it long enough to see results. Because that's the other thing. You can do whatever it's the right thing for you, but are you doing it consistently long enough for it to work? So that's also another thing I often see with people that come to me. It's like, okay, you've done the right thing, but at some point, when you're by yourself again, you're just like, I'm doing everything right. It's not working. Well, stick to it. And, when you have someone to measure, remeasure, like, okay, that was hurting. It was hurting in the morning when you were going out of bed. It was hurting putting your socks on. Is it still hurting 2 weeks later? Oh, no, it's not hurting. Oh, well, that's a win. Okay, we're going in the right direction. And then 2 weeks later, is it still hurting when you bend to wash the bathtub, for example? Oh no, yeah, true, that was hurting. And like, oh, okay, I'm actually
Yeah.
getting better. Sometimes you need someone because you
To
forget.
highlight.
When you feel
Yeah.
better, you're like, oh, I feel better. Like you forget. The person can say, okay, I still feel pain. I'm not getting better, but like you forget how worse it was
Yeah.
before. So sometimes you need someone to just remind you, okay, you're getting in the right track and don't stop. So
Yeah,
yeah.
definitely. I think it's like you're totally right there. It's super hard to see yourself, see your own progress. The little things sometimes that can make such a big difference. Like instead of every time you put your shoes on and off, which can be quite a lot during a day, like that quality of life. And you can kind of sometimes get stuck in that mindset of, oh, is it getting better? And then you forget all those things because that was 2 weeks ago. And, you're not really focused on that. You're just focused on when you do get the pain. And then it takes someone like holding up that mirror and going, like you just said, well, you are improving. We're not there yet, but we're getting there. And that can help with that motivation for sure. I was going to ask, do you see much difference between kind of the injuries between kind of male and female surfers?
Interesting, because I've been treating way more male surfers so far
Okay.
because I think there's more male surfers
I
probably.
think I think there is,
But
but that's changing.
yeah, it's changing gradually. But that is very interesting, and I'm looking forward to treat more women, especially maybe postpartum women because I
Mm,
think that
I
would
was
be
going to
very
ask about that.
interesting. Yeah, just like the core issues and like that anterior pelvic tilt posture. That I know I've had clients that were complaining about that because well, after having a baby, all of this is stretched and not that
Of course.
strong. So yeah, and surfing is a sport where definitely that puts a lot of pressure, intra-abdominal pressure if you're not dealing with it properly, and sometimes the C-section scar, and yeah, all of that. I haven't had the chance as much as I would like, but I'm sure those cases are super interesting because yeah, I've treated a lot of women that want to go back to running, for example, earlier in my
Yeah,
career after having a baby. And yeah, I'm used to that, to rehabbing that zone. And yeah, for surfers, I think it's super, super relevant.
for
Yeah,
sure. And probably not again, a very serviced, population. Like generally postpartum women they don't even realize they can get rehab because nobody tells them.
yeah, yeah, definitely.
So let this be the call out to all the postpartum ladies who surf, go and book yourself in
Yeah.
with Maud.
And also, so interesting, like the women that continue surfing throughout their pregnancy. I haven't had kids myself, so I haven't had the chance to try it. But like with, I see sometimes videos of like
Yeah,
women
yeah,
going prone on their belly, and
yeah,
so I'm just. It amazes me to like understand why some people are able, some other people aren't, and yeah, it's so interesting the human
definitely.
body. Yeah.
Yeah, super cool. Is there anything else you think we should talk about that you want to talk about? I think we covered quite a lot of ground.
Uh, Sure. Anything else you had in mind?
I think that was kind of
Um,
the main thing is
yeah.
to just crack open that specific area.
And so you work mainly as a trainer, right?
So during my physical in real life world job, I'm a chartered physiotherapist in a private clinic. So
Mm-hmm.
um, that is a very big mix of, the whole scope of physio, post-op to return to play to it could be anything. But online, yes, I do mainly one-to-one, more the surf fitness or surf strength and conditioning side of things. But obviously I have my physio brain. So
Mm-hmm.
often it's people who've had injuries who are looking for that personalized approach that will take into consideration their injury history, whether that's back pain or, you know, foot injuries, knee injuries, whatever it might be. Um, yeah, they're just looking for a bit more of a holistic than just super hard training
Mm-hmm.
sessions or a generic program. But yeah,
Yeah.
more the training side and specifically for women because I just feel like there's not much representation again for women surfers and
Mm-hmm.
women professionals serving that population. Again, there's quite a lot of kind of fitness trainers popping up, which is great, but I just think there's also a need for something slightly different. So yeah, I'm trying to put myself in that niche.
Yeah, that's so true that there's not that much for women, and yeah, it's a very specific population. I'll get into it more. I want to treat more women, honestly. Yeah.
Yeah,
Uh, actually, yeah. Well, in the clinic, I treat in the clinic surfers in the private setting. Mostly active population, but I have a lot of surfers coming to me because we're close to the ocean, and yeah, online as well. But yeah, there's more men coming. Or maybe the men are more injured, or I don't know. I don't know where to. Let's try to reach the women,
yeah,
the women
explore that.
surfers. Yeah,
And you're based in Canada, is that right?
yeah. I'm based in Canada, Nova Scotia, so it's very cold there right now. The surf. I just went in the morning, -5 water
Oh,
temperature, 1 degree.
wow.
So
So
after an
full kit.
hour, you're done. Yeah, I'm trying. So my 6'5" wetsuit is out of order. It's too much water getting in. So I went with the 5'4", where I put like
Oof.
that a merino like little
Layer, base layer, yeah.
yeah, because if not, I wouldn't make it. Like after 50 minutes, I was like, okay, water's getting in. I'll have to go out soon.
And
But
is that
anyways,
like 7 mil gloves and boots?
yes, pretty
Yeah,
much. Because if not,
yeah.
you're too cold. And then once you take off your gloves, you have like 30 seconds to get into your car because
Then it's
yeah,
game over.
yeah, you're like, oh.
I mean, Ireland is not particularly warm in the winter, but it's not like I don't think it's the same. You get like proper cold, cold snow and
Oh yeah,
yeah,
yeah.
like our water is still, I think, +10 at the moment, and
Oh,
that's
okay,
Celsius. So
yeah,
you would probably be in like a 3-2 saying
yeah.
this is so warm.
Yeah. No, actually, here we almost never wear a 3-2. It's more like a 4-3 most of the
Okay,
time.
yeah.
Yeah.
So even in
Unless you
summer.
go like in the summer, if like the super sunny day in August, September, by the time the water gets a little
Yeah.
warmer, sometime beginning of October, like okay, 3-2 during the day, but like not in the morning, not at night. Yeah. But
Yeah.
yeah.
Okay. Very
So yeah,
specific.
pretty cold. And that's pretty
Yeah.
hard for the body as well. Like if there's cold water surfers watching, like your muscle gets so tense. Like
Mm.
so I think that's also a factor that influence back pain, like the temperature. And
Yeah.
yeah, and maybe in a
True.
hotter climate, it's also influent. Like you get so dehydrated. I lived before coming here, I lived in Mexico, and sometimes you get like, yeah, so dehydrated, and you're just like, sun is, yeah. So
On the
we're so
extremes.
exposed. Yeah, we're so
Yeah.
exposed to the elements, and I mean, surfers are stoked. Like either you love it or you don't
You
do it.
don't survive.
You don't surf because like you need to really love it, and then you once you're in the water and you like get some wave, you're like, okay, one last. So that's also something like surfers, they always overdo it.
That's so true, yeah.
Yeah.
It's like, oh, just 1 hour, 4 hours later.
Yeah. So we're pretty hard on our bodies and yeah,
Yeah.
think
And that's super hard, isn't it? To then kind of, when you get to that point where you're like, maybe you need to take some time off surfing and you're going back into some gradual exposure of, even with something like a lateral ankle sprain, it's like, right, well, take a foamy out for 20 minutes. Like, it's super hard to control what happens in that 20 minutes. Like, you could have
yeah,
another person on a foamy crash into you. You could just overdo it yourself. Like, there's so many variables to try and control for like that return to play phase if someone has been out for whatever reason. Um, yeah, it's an interesting
that's so
sport, I
true.
think, the chaos of the sport
Yeah,
and the
so
nature of,
unpredictable.
yeah,
That's what
even
makes
like
it
the forecasts
so
and
addicting. Yeah, because you never
yeah,
know when you're gonna get waves. If there is, you want to be there, you want to go, you don't want to miss it. And
yeah,
then, as you said, like for injuries, it makes it hard because, um, for example, I used to work with runners before when I was landlocked in Quebec. But with runners, it's very easy. So you can choose the terrain. You can only run on flat surface, only on concrete, not on sand. Or like you can say, okay, you're just gonna go for 1 minute run, 1 minute walk for 10 minutes at that pace. Like it's very, very
yeah,
precise and it's very easy to quantify the load that you're going to
yes,
put on whatever structure is injured in your body, whatever part of your body is injured. For surfing is just like, okay, you can quantify the time, the duration. As you said, you can choose a different board, which will influence the forces on your body. But other than that, it's like, what you never know. Are you gonna like the waves are they gonna be big? You can choose your days, but then you don't have like the repeated
yeah,
stimuli of going often enough to get your body to adapt. So if you're
yeah,
only going in small days, then you might be 2 weeks without going, and then so that's such a challenge, and that makes it very interesting as well.
definitely. I think from like an evolution kind of standpoint, wave pools, I always think of them like, you know. we could probably use them as like more controlled environments in a way, because you know if you surf the same setting for the same amount of time, that is probably going to be like the most controlled environment in a way of which you can return to surfing, if that makes sense. Like, but even from just a load management for, a performance point of view, it's so dynamic. Like if there's suddenly this really great swell that comes, you don't want to train, like you're gonna drop everything to go and surf. Like that is the point. You're not training to train. Well, some people do. Some people love training as well, but it's learning and being coached of how to make those decisions sometimes of, okay, well, I surfed 6 hours in the last 2 days. Maybe I don't need to do a full strength session today and I need to actually focus on recovery. And I see that a
Hmm.
lot with the clients I work with is like they're super motivated to do their strength work, their conditioning, and their surfing. And it's just too much. And then you get
Yeah,
all the overuse injuries and the tendons
yeah,
start screaming. And so there's also that other side where just surfing, it just promotes this kind of extremism in behavior
that's
and
true.
load. So it's
So true.
it's trying to find that balance throughout that week
Yeah,
or that month of like, yeah, how can
yeah.
we quantify it? Can you just give it some rate of perceived exertion scores, after your surf? Was it like an 8 out of 10 session in terms of what it took from you? And yeah,
Hmm.
I think it'll be very interesting to see researchers potentially developing some more objective measures or ways to um like measure how someone's doing. Because I know in a lot of professional sports, they do something like a counter movement jump to see like the nervous system's fatigue. And I'm like, well, you could do that with surfers. I mean, most surfers won't know what a counter movement jump is, but there's that whole sports science field which is slowly like creeping in since the Olympics. And I think
Hmm.
I think surfing could look quite different in maybe another decade or two, but there's
I
all
think
that
it will.
information out there that we can apply to surfing. It's not easy. It's maybe more like a sport like Ironman, where there's so much volume of training and, you know, just how to manage it all.
Yeah, I think it's changing, as you said, like since the Olympics and since the wave pools, and there's more and more studies getting done, and that's gonna guide us as therapists and also the coaches to like do their like applying the best practices. But meanwhile, we have to deal with our personal knowledge, personal experience, trying to put everything together, and yeah, finding ways to manage the load. As you said, it's always challenging, and I'm trying to learn that myself. Here, being in the water only for 1 hour at a time, I can see how my body like can adapt like better than if I go like for 3 hours. And sometimes like when you're in the water, like feeling like okay, like where is my limit? Like if you're injured, like where is my limit? Am I reaching? Like just being more aware and see like, okay, now it has to be my last wave. And you don't want to go out, of course, but like just like being coached to like have that limit that will make you progress faster because there will be other waves. And we know that. It's just that when there is a swell, you're like, I don't know, I want to get the most of it. But if you have someone in your corner putting like the limits to be able to for your body to recover, because like I'll always use that example of that jug of water. Like everything you do in a day will put some water in your jug, and the jug is like your capacity. How much, for example, if you're injured from your lower back, like how much can your lower back handle during the day before the symptoms start appearing? So if you are working, you're going to train, and then so there's already maybe half the jug, and then you serve for 3 hours, it might overflow, but if you serve for one, it might be close but not overflowing. And that's the thing I say to my client, like if you get close to the limit without overflowing, that's where the magic happens. That's where the changes in the body, because you're stimulating your body enough to ask him to react and adapt. If you're not filling the jug at all, or like half, the body will be just easy, I'm good.
Yeah.
If you're going close to the limit, you're like, oh, okay, like I might be the same tomorrow, it might be more tomorrow. So the body just put like everything together, like bringing the cells to the places the body feel like there's overload inflammation to make it stronger, and then your jug gets bigger, and at some point you can fit 2 hours of surfing on top of everything else. So sometimes just having that in mind when you're injured and just being okay, there'll be more waves. I'm close to the my limit of my jug, and if I overflow, I'm going backwards. I don't want that. My jug cannot be bigger. My capacity will not increase if I keep overflowing and you keep like swiping the floor instead of working on building the jug. You're never gonna get better. And that also happens at night. If you sleep well, eat well, you're not too stressed, that time
Yeah.
at night, it's when if you get enough sleep, that's where it's supposed to happen, and it will happen. Just when you know how the body works, you're so empowered to like do the right thing long enough so you actually get better. And yeah, I think that's
Yeah,
something,
definitely.
yeah, little
It's a
people
great
know.
analogy.
And mhm.
I like the mopping the floor part. When you've done too much, you're gonna have to mop all that up.
Yeah, that's the inflammation. You're mopping the floor and like, okay, like
Yeah.
this, there's a mess, and we don't have time. Like during overnight, you have only a certain amount of time to mopping and like building up your capacity.
Yeah.
No time for that. Just all night you'll be mopping.
That's great. I'm gonna steal that.
Do it. The spread the jug analogy.
Yeah. I've heard of it in kind of the reverse form where you have resources and there's a tap on the bottom, and the tap at the bottom is what drains your resources, and there's stuff going at the top, what's filling your resources. So like
Mm,
it's just about the balance, but I've never heard
yeah,
about the jug getting bigger, but I like that and like overflowing. That's cool.
yeah. Yeah, well, it's the load management. That's just one of the things, on one of the strategy you need to understand. Like on top of everything else, like if your joints are not moving well, the jug will fill faster because the jug represents the capacity of one joint to handle the load. So if the other joints are not handling the load well because they're stiff, then you only have one jug to handle the load instead of many. So
Mm,
that's also why you always have to look, okay, that ankle sprain you had 5 years ago, you didn't go rehab or anything like that. Are you able to put your foot next to a wall and bring your knee to the wall and have that same space between your big toe and the wall on both sides? If
yeah,
not, that might be one of the reasons why, you have knee pain, hip pain. So there's other joints you need to look at also that will influence how much load there will be on the joint that is injured. Yeah.
definitely. I think that's quite typically what I end up working with more online is exactly that, is generally like semi-rehabbed or unrehabbed injuries that, during movement screens, I'm like, oh, any injuries to that left ankle, because you see the squat and you see that they're just not getting that dorsiflexion. And then it turns out, yeah, I rolled that ankle pretty badly about 5 years ago, and I've had all these injuries on that side since. And again, it's we know to look for these things kind of thing, but I can imagine for people learning about their own bodies and like similar to you, like I've had my own injuries that I went through all those processes, and it's really hard to learn it about yourself on your own because even if you have the knowledge, you cannot see yourself objectively. So it's just, yeah, I'm just such an advocate for just go and see someone, like get it assessed by someone who's good at you know, their job and the respect of the sport that they treat, and it'll just pay you back in dividends. Like it'll save you so much time and just frustration of doing the wrong thing and spending money, and it's just simple. Just go and get it checked.
Yeah, such an investment for life because
Yeah.
once you go through that process once, people sometimes ask, well, yeah, but what if the injury come back? Well, it might come back. Like, and
Mm,
there's no guarantee. I mean, at some point you had that injury once. It might, for example, disc issues. It's very common that they flare up again. Even if you do the right thing, you're pain free for a year, you might do that movement, or at some point, I don't know, your posture change, you're less active for a little bit, and then the pain comes back. You it happens. It will come back. But if you've been through the process on rehabbing it once and you understand what triggers it, what you needed to do, what are your weaknesses that you have from life, from previous injury, from movement habits, whatever caused it in the beginning. We don't really need to know what caused it, but like once you identify what are those for you, is it weak glutes? Is it like hip stability? Whatever it is, once you know what is it that caused your pain, and you probably stop your exercises at some point, right? Because oh, you're feeling better, life goes on, and then you have the pain again. The first sign you'll be like, oh, I know that. Oh, I don't want it to come back. Then I'll go back to what I was doing. Pay more attention. Maybe put a cushion behind my back when I sit, or so I'll go back to my good habits, and then you might just like get that injury to not come back because you learn so much about your body. You're able to, detect it fast enough and then change your behavior, change your habits. So you just have like that little stiffness and then whoop, it goes back, it goes away fast because you knew what to do. And then you'll be a bit more careful the following months and you'll be, and maybe you'll restart strength training again, and it's life. And once you know that, it's like, okay, so empowering because you're not worried that it comes back out of nowhere and that you don't know any like why, and you don't know what to do about it. So I think that's the most important, like it's what's the most valuable from going with someone for
yeah,
rehab
definitely.
one-on-one. Yeah.
You get that toolbox of, like you said, oh, I noticed it's getting a bit stiffer. It probably needs a bit more of this. Or like you learn how to manage your own condition, if it is a condition, or, like you said, there's going to be moments where maybe you're on a surf trip and you get tired and you don't, focus so much on what your pelvis is doing because you're having a great time and you get tired and you get stiff. Okay, I can de-escalate this situation. I can do X, Y, Z, and then I'll feel great again tomorrow and I can surf again. Or it just gives you that tools to like independently manage, prevent. Yeah. Knowledge is power, like for sure. I think it's so important. Like the aim for us is to let someone go off into the wild on their own to manage. Like you
Exactly.
make yourself redundant is our aim, which is quite
Hmm.
strange, but that is essentially our aim, isn't it? We don't want to be working with someone necessarily for any longer than they need. Obviously we're there if they need to check back in and things aren't going the way that, you know, they'd hope, but that is the aim, is to independently allow people to manage their specifically back pain, I think, because it's such a global problem, isn't it? With so many people experiencing it. But with any injury, I think it's so, yeah, such an investment to learn about your body and how it works. And yeah, personally, again, as a patient, when before I had any physio training, I was one of those people who was searching for the answer, searching for this is not quite right, but I don't know who to go to because I went to physios who weren't very specialized in sport because I didn't know that existed, despite playing like really high level sports. We just had very poor funding. And yeah, when I did find one, I was like, oh wow, it's really this simple, huh? Like, it's the basics of in our industry, it's basics of load management, looking at joint stresses, anterior, posterior. Like it's not rocket science in that regard, if you know what I mean. So I was just a bit mind blown when I was like, oh, where have you been my whole life? And then I just thought, oh, I think that's what motivated me to get into the whole physio and rehab world was I just want to be able to provide that to other people,
Yeah.
which
Most
sounds
physio,
maybe
I
a bit
feel like
similar. Yeah,
most
but
physio, I
failed
feel
at
like
it.
we had an injury and then we found someone that helped us and basically changed your life because
Yeah,
pain,
yeah.
it
No joke.
affects your quality of life so bad,
Yeah.
especially when you like you love surfing or you
Yeah.
love like whatever your sport is.
Yeah, yeah, for sure. Even if
It's
it's just
like
walking your dog or whatever, it's
like when you can do what you love doing, it's just like your whole life falls apart and like just people just stop moving when they have a pain, worrying about aggravating it, and mental health goes lower because of that, and it's such and like just moving is so important. And when you feel pain while moving, like the natural reaction is like, no, I don't want to move, but that movement will actually help if it's done like the proper way. And also I say the proper way, but any movement will help better than not moving. I don't want to like scare anyone of movement. So that's something also our profession, I think we have to be careful about not
mm,
scaring people from moving, because there's not one good way to move. You can move anyways. It will be always better than not moving. I think that's a very important one to remember. Yeah, it's just that when you have an injury, well, sometimes there's little details that can be added that will make a difference. But like if you're wondering, should I rest? I'm in pain, my back just tweaked. Should I stay in bed all day? The answer is no. So continue moving, change position often. Yeah. So and then of course if it continues, the pain continues, go see someone. But yeah, more or
yeah,
less
that's a good
general rule.
message.
Yeah.
Yeah, keep moving as much as you can within your limits of where you're at, isn't it?
Yeah. Just adapt. If something hurts, just do something else. I think you'll be better off. Like as a general advice, you would be better off moving than not moving. Uh, I remember when I got my first injury, the one that got me into physio, it was a hamstring injury because I was in martial arts and I was practicing getting my split and to kick higher. And at some point I got a big strain. I think I tear my hamstring, and well, at that point I didn't know. I was 14 years old and I didn't know what to do, so I just kept re-aggravating it, right? Like I wanted to kick again, I wanted to go, so I was limping and I was going to my martial art training, so that was not the right thing to do. But I didn't know about physio. I didn't know what to do. I went to see the doctor, just tell me to rest for a week and like give me pain medication. So I was just like, okay, that's it. So I really understand like what is the frustration of like not knowing why you're in pain and what to do. Like,
Mm,
yeah, that's the worst feeling ever. So, and I that's a chronic injury. I'm still dealing with it at that day. But what helped me at the time is that I went into boxing. I just stopped kicking high and just went into boxing. And that's at that time, that's what I needed. I kept moving, but I just did some other sort of movement for a while, and then I could go back to martial arts after that. And I was like, okay, like I should have done that from the beginning, and it wouldn't have taken that long. But stuff that you don't know, we just live and learn. And when I saw someone that really really helped me, so I wanted to become uh, physio after that. But yeah,
yeah,
that's the
another
story.
classic story. Yeah.
Yeah.
Oh, thanks for sharing.
Yeah.
It's really cool
Thank
to
you.
hear and to like speak to you and just, hear as well from your side what you're seeing. And yeah, it's just good to talk about those things that as, shared experience, I suppose, of working in a modern world as
Mm.
people who serve surfers with different kind of, yeah, focuses perhaps, but, same kind of
Yeah.
outcomes. Where can people reach you if they want to get in touch and maybe, book in for a one-on-one with you?
Yeah, the easiest way to reach me is on my Instagram account, so nalu.motion. And yeah, just send me a DM and I'll be happy to chat with you and see if we can work together or just ask me whatever question you want.
Nice. On Instagram
Yeah.
at naidu.motion. Perfect.
Yeah.
And same for me. If you want to reach me, you can go at Stoked Surf Fitness, slide into the DMs, or there's a direct application form either. But yeah, thanks a million for the chats. It was really enjoyable.
Thank you for having me and hope to do it again.